Hello, friends. Welcome back to Complete Medical Coding. Welcome to my channel after a short break. So, friends, I hope all of you are doing well. And I know that so many new students or new people, those who are interested to learn medical coding, or those who are um, those who wants to do this as their career. So many people are coming into this field nowadays. So I hope my channel will be useful, especially for those who are preparing for the CPC examination. I'm mainly focusing on the CPC right now. Okay, so let's do some practice questions today. Let's do some ICD10-CM practice questions today. All right, I'm moving directly to the questions. Okay, these are some important practice questions, like how to check on the ICD code book. Okay, let's see one by one. What is the first question? Malignant neoplasm of sigmoid colon with metastasis to liver. Treatment is directed at primary site. How will you code? So, the treatment will be on the primary site. Okay. Here we have to code for the malignant neoplasm of sigmoid colon, right? So, let's move to the options. What is the first option? C18.7 and C78.7. So, what exactly we need to code here? Malignant neoplasm of sigmoid colon. Okay, metastasis to liver. So it means it is getting spreading to the liver. So, but which is the primary site here? What is the main thing that we need to code? The main site which we need to code is sigmoid colon, right? Because in the question it is directly written like that. So malignant neoplasm of sigmoid colon. It means the first primary site is sigmoid colon. Metastasis to liver means it is spreading to liver also. So it means in liver also there is malignant neoplasm. So first you have to code for the sigmoid colon neoplasm, and then secondary site as liver. Okay. So that's how you need to code this. The first option, C18.7. So what is C18.7? C18.7 is malignant neoplasm of sigmoid colon. Okay, same same as what we need. The primary site, which is sigmoid colon. So that is C18.7. And what is C78.7? The second diagnosis, the same option. C78.7 is, what is C78.7? C78.7 is malignant neoplasm of, C18.7 is malignant neoplasm of sigmoid colon, and C78.7 is, will be the malignant neoplasm of liver. Okay, secondary malignant neoplasm of liver. Of course, here metastasis to liver. So it means the second site is liver. So secondary malignant neoplasm of liver. Okay, so that is what we need. And if you go to option B, the same codes, they have mentioned it. Vice versa. C78.7, which is liver malignant neoplasm, and then C18.7 sigmoid colon. They have just reverted it, vice versa. But then that's not the correct sequence of coding. You have to always follow the sequencing. So B is wrong. And what is C? Option C. C80.0. What is C80.0? Disseminated malignant neoplasm unspecified. No, it's wrong. And if you go to option D, Z85.038. Z85.038. What is it? Z85.038. Okay, Z82, I put 82. Okay, Z85.038. Personal history of other malignant neoplasm of large intestine. No. Since we have the direct code, you have to always follow the direct code. So here the answer is option A. The primary site is malignant neoplasm of sigmoid colon, and then secondary C78.7, which is liver site. Okay, the site of liver is secondary code. So answer here is option A. Now moving to second question. Initial encounter for right ankle fracture due to slip on ice. How will you code? So initial encounter. As you know, the seventh character, the encounter like initial, subsequent, sequela, all will come in as the seventh character, right? If it is initial encounter, the alphabet of seventh character will be A. If it is subsequent encounter, it will be D. And if it is sequela, it will be S. So from that itself, you can identify what will be the correct answer. You can save time like that, right? So if you check the options, so here we have to code for the initial encounter of right angle fracture. Okay. So if you check the options here, in option A, two codes are present. Both represents initial encounter because the alphabet is A. The seventh character alphabet is A, which represents the initial encounter. If you go to option B, in both the codes, the seventh character is D, which is subsequent encounter. So you can directly mark option B as wrong answer because it is subsequent. And C, in option C, the seventh character ends with S, which is sequela. So that's also wrong. Okay, and in option D, nothing is given in option D, like no seventh character. So obviously it will be also wrong. Mostly it will be also wrong, but we will check option A and D because in question it's directly mentioned initial encounter. So in the answer, there will be initial encounter alphabet. So of course option D will be wrong. Okay, so you can go for option A as the right answer. Okay, still if you need, you can just cross check if the given code is correct or no. Okay, so in option A, what is the first code? S82.91XA, which is unspecified fracture of right lower leg, initial encounter. Yes, initial encounter, same. Okay, now if you go to the second code, W00.0XXA, fall on same level due to ice and snow, initial encounter. Yeah, slip on ice is mentioned. So the initial encounter for the ankle fracture and how it is caused. The cause should be secondary. Okay, which is slip on ice. So answer is option A. All right. Now third question. How will you code a patient with COPD, exacerbation and acute bronchitis? The patient is having COPD, coronary obstetric pulmonary disease. Okay, coronary obstetric pulmonary disease. So the patient is having COPD with chronic obstructive pulmonary disease. So the patient is having chronic obstructive pulmonary disease and acute bronchitis. So both you have to code. Okay. So what is option A? J44.1 and J20.9. So what is J44.1? J44.1 is COPD, chronic obstructive pulmonary disease with exacerbation. All right. And J20.9 is acute bronchitis. Now let's check the other codes as well. Option B, J44.0. What is J44.0? Same, chronic obstructive pulmonary disease, COPD, with lower respiratory infection. Okay, but this is not lower respiratory infection. This is it's directly mentioned as bronchitis. So you cannot quote B as the answer. Answer. So B will be wrong. Now if you check option C, J44.9. What is J44.9? J44.9 is chronic obstructive pulmonary disease unspecified. It's just mentioned COPD only. Bronchitis is not mentioned. So that will be wrong. Then the next one, J20.9 is acute bronchitis and J44.1 is COPD. It's the same code as in option A, but vice versa. So as you know, in ICD, the sequencing should be correct. So the first one will be chronic. Of course, you have to always code for the chronic diagnosis first, which is COPD. Okay, so J44.1 you have to code first, followed by acute bronchitis, which is J20.9. So answer is option A. All right. Now let's see move to fourth question. Patient has essential hypertension and chronic kidney disease stage 4. How will you code this? Okay, so these are the questions which are based on the sequencing. Okay, so here patient is having hypertension as well as chronic kidney disease stage 4. Okay, so if first you have to always check if there is any combination code. If there is no combination code, you have to code it separately. Anyway, what is the first option? I10. I10 is essential primary hypertension. And what is N18.4? N18.4 is chronic kidney disease. Okay, N18.4. Chronic kidney disease stage 4 as mentioned. So I10 is hypertension and N18.4 is chronic kidney disease. Wait there. Move to option B. I12.9. What is I12.9? I12.9 is hypertensive chronic kidney disease. Hypertensive chronic kidney disease with stage 1 through stage 4 chronic kidney disease. So yes, this is chronic kidney disease and patient is having hypertension. So you have to go for this code I12.9. Okay. So that's what I told you before. If there is any combination code, you have to always use the combination code. Now if you go and check option C, I13.10, let's check that also. What is I13.10? I13.10 is hypertensive heart and chronic kidney disease without heart failure. No, here it's not mentioned about heart failure or heart disease. I mean separately, it's about chronic kidney disease. CKD is mentioned. So that is wrong. Again, if you go to option B, I12.0. Okay, what is I12.0? Same, hypertensive chronic kidney disease with stage 5. But for us, we need stage 4, which is already in option B, I12.9. Stage 1 through stage 4 is mentioned. So whatever the stages in the question from stage 1 to stage 4, you can use this code I12.9. Okay. And for stage 5, there is a separate code I12.0. So our correct answer is option B here, I12.9. All right. Hypertensive chronic kidney disease. Now moving to fifth question. Care contracture of left hand due to old burn. Old burn will always represent sequela. Code this. So old burn, sometimes in question itself they will mark it as sequela. If it is not mentioned, you have to understand that old burn is always sequela. Okay. So scare contracture of left hand due to old burn. So you have to code for the scare of the sequela burn. Okay. Moving to options. What is the first one? L90.5. Okay. All skin related diseases mostly starts with L, but this is burn. Burn codes starts with T. Injury and poisoning or burn, everything starts with T. So this is L90.5, which is L90.5 is scare conditions of skin. Scare conditions is, it just mentioned the scare. It doesn't mention about any burn. That's wrong. Now, if you go to option B, T23.302A. A represents initial encounter, so you can skip it because in the question it is marked as sequela. So you can directly skip option B. Okay. So sequelae always ends with S, as I told you before. The seventh character will be S. So obviously our answer will be C, option C. Still, we will go and check T23.302S. Okay, what is T23.302S? Burn of third degree of left hand, unspecified site, sequela. Yes, this is what we need. Third degree, of course, it will be sequela. Okay, so scare contracture of left hand due to old burn, which is sequela. That means it is third. Sequela always represents third degree only in the burns. So here it will be option C. If you want, we will just check option D as well because it is starting is Z code, Z87.828, which is personal history of other healed physical injury and trauma. No, even though this is a history, but still it is, again, that scare is present from the old fracture, which means from that old burn, from that sequela, the scare is coming out. So you have to always code for the sequela of burn. Okay, so answer here is option C, T23.302S, sequela of burn, scare contracture. Okay. Moving to sixth question. Type 2 diabetes with diabetic peripheral angiopathy, no gangrene. How will you code this diagnosis? So this is simple. You have to code for type 2 DM, type 2 diabetes with diabetic peripheral angiopathy. People will think during examination that some questions like this, for example, I'm saying, it may seem easy, but when you think that, okay, this is so easy, I can score easily marks or I can save time going and checking only one or two codes, then marking, sometimes it will go wrong. Or if there is more than one code, sometimes the sequencing might be wrong. So you have to be very careful. Even though if it is a simple question, you have to be careful. Okay. Anyway, moving to first option, E11.51. Okay. What is E11.51? Type 2 DM with diabetic peripheral angiopathy. Yes, without gangrene. Of course, this is what we need. Still, we will check the other. I'm just checking the other options as well. Option B, 11.9, which is type 2 diabetes without complications. That is also correct, but we have a direct correct code. 11.9 is not correct because we need type 2 diabetes with diabetic peripheral angiopathy. That combination code we need, which we already got in the first option. Option C, 11.40 is type 2 diabetes with diabetic neuropathy unspecified. Now we need diabetic angiopathy, right? And if you go to option D, it is I code. I code represents some other, which is not diabetic. Peripheral vascular disease. No, that's wrong. So the correct answer is option A, 11.51. Type 2 diabetes mellitus with peripheral angiopathy. All right. Seventh question. Child seen for otitis media, recurrent, acute, bilateral. How will you code this? So the patient is having otitis media, acute, recurrent, otitis media, bilateral. That is what we need to code. Okay. Acute, recurrent, otitis media, bilateral. Let's move to first option, H66.93, which is H66.93 is otitis media unspecified bilateral. It's not mentioned recurrent. Recurrent term is important. Same code in option B, along with H66.001. So what is H66.001? Acute suppurative otitis media without spontaneous rupture of eardrum. No, that is wrong. There is no spontaneous rupture mentioned. All right. Again, option C, same code H66.93 otitis media along with H66.006. Again, acute suppurative otitis media without rupture of eardrum. No. Now, if you go to option D, acute suppurative otitis media, yeah, this is the one which we need. Same as in option C. H66.006. This is the code we need. Acute suppurative otitis media without rupture of eardrum, spontaneous rupture of eardrum. That is an extra thing which is mentioned in the description. That's fine. Okay. Recurrent bilateral. Yes, that recurrent term we need. So this code is same as in option C. H66.006. But along with that, in option C, they have mentioned the otitis media bilateral separately, which is not required because already suppurative otitis media is present in the current code, which is H66.006. Okay, so we need that one, and it's mentioned as bilateral and recurrent. So that is the correct code. So answer here is option D. D, only H66.006. Okay. Now, eighth question. How will you code a pregnant woman in third trimester with mild preeclampsia? So third trimester pregnancy with mild preeclampsia. Okay. So you always know, as I had mentioned before, that pregnancy codes always starts with O code. You have to always mark O code as the primary code. And if there is some other complications or something else, like gestational weeks or something like that, that you have to code it secondary. Okay. So moving to first code O13.3. What is O13.3? O13.3 is gestational hypertension without significant proteinuria, third trimester. Now we need mild preeclampsia. So that code is wrong, hypertension code. Moving to second one, second option O14.03. Mild to moderate preeclampsia, third trimester. Yes. In our question, it is mild preeclampsia. So mild to moderate, you have to use this code, O code. Even though mild, or if in the question moderate, same this code, O14.03 you have to use. But along with that, the patient is in third trimester. So that also you have to code. So go to option C, the same code. Here it's mentioned only third trimester. It didn't mention that how many weeks the patient is. 30, 33, nothing is mentioned. If it is mentioned, you can mark it directly. If it is not mentioned, you have to mark accordingly as per the question, because here third trimester is mentioned. So is it mentioned? No, in third trimester only is mentioned. So you can, if you see option C, Z3A.30, which is 30 weeks of pregnancy. And if you go to option D, the same O code with Z3A.28, which is 28 weeks of pregnancy. So in the question, it is mentioned only third trimester. So from that, you have to identify which code should be used. So you have to know the weeks of gestation, like in first trimester, how many weeks, that you should know. Then only you can code such type of questions. So 0 to 12 weeks represents first trimester. 13 to, like from starting 12 to 28 weeks represents second trimester, and after 28 weeks till delivery, it is the third trimester. So here if you mark D, that is 28 weeks which falls under second trimester. So here sorry, so here, since the question is third trimester, you have to go for 30 weeks. So answer here is option C. Okay, O14.03, Z3A.30. Okay, like that you have to identify it. Now, ninth question, obesity. Obesity BMI 34, adult. Code the scenario. How will you code obesity? A patient with obesity with BMI 34. Patient is an adult. So, first option, first code E66.9. E66.9 is obesity, the code for obesity. Okay. And BMI, since BMI is also mentioned, you have to code BMI also. Because for obesity cases, you have to always mark the BMI. So option B, you can see the same obesity code along with Z68.34, which is BMI code. Okay. BMI 34 to 34.9 adult. Yes, 34 here. So that one you have to code. If you go to option C, only BMI code is mentioned, which is wrong. You have to code for obesity as well. And in option D, that's again only the obesity code. Morbid severe obesity only is mentioned. So since obesity BMI 34 is mentioned in the question, you have to always go for obesity and BMI. If BMI is given, you have to mark the BMI also. Okay, so obesity plus BMI code is required here. So answer here is option B, E66.9 for obesity and Z68.34 BMI code. Okay, 34. 10th question. Patient with severe major depressive disorder, single episode, no psychotic features. How will you code a patient with severe major depressive disorder, single episode? Let's directly go to options. Usually F codes is very rare in the question papers, but still you have to learn it. Sometimes you will get it as well. Okay, maybe one question like that. So F32.9, first option, major depressive disorder, single episode, unspecified. Let's go to option B, F32.2. You have to check all the codes and check which is the accurate code. Okay, accurate answer. F32.2, major depressive disorder, single episode, severe, without psychotic features. Yes, see, no psychotic features. In the question it is mentioned, no psychotic features. You go to option C, F32.0, which is major depressive disorder, single episode, mild. No, this is not mild, this is severe. So option C is wrong. And if you go to option D, F33.2, major depressive disorder, recurrent, severe, without psychotic features. See, all the options marks almost same. So option D is recurrent mentioned. Another additional word, recurrent, which is not in our question. So option D is also wrong. And in option A, it is just mentioned patient with severe, patient with major depressive disorder, single episode. It didn't mention about the severity or no psychotic features. So A is also wrong. So here the correct answer as per the question is option B, F32.2, which is severe major depressive disorder, single episode, no psychotic features. Okay. So this is how you need to find out if all the options in the question shows or marks as the same. It represents the same description as in the question, but you have to read the question very carefully. You have to mark exactly as per the question. What all details is mentioned in the question, everything should be there in your answer. So like that, you have to choose which is the correct answer. Okay. If you go for option A, sometimes you feel that option A is correct. Okay, I'll mark it as answer as option A without checking the other options. But no, don't do like that. You have to go and check the other options as well. Okay, in order to make sure that your answer is correct. All right. So here B is the answer. So friends, that's it for today. That's it. These are the few important ICD practice questions. These questions I have given in order to make you understand the guidelines, the sequencing guidelines, or the answering guidelines, how to make it, how to choose the correct answer. That's why I have put this type of practice questions, especially for the beginners, or you can say, yeah, those who are preparing for the exam. I think my videos will be useful. So friends, that's it. If you are new to the channel, please subscribe. Please, if you have any doubts, mark it in the comments. I'll get back to you soon. And thank you so much. Please share it among your friends. Yeah, thank you so much. Bye. Take care. See you in the next episode. Bye.